Hi everyone, it's Joseph again, and I'm doing another video. Um, I'm doing a video on COVID, um, just how COVID has been doing during the last recent year. I'm I found this great article, and I'm going to summarize it. But it basically says like COVID hospitalization hotspots across the U.S. It says COVID-19 hospitalizations are declining after a surge in December and January. Um, so this map shows the hospitalization rates, and then there's another where the about how much hospitalizations have increased. So it looks like let's see, one of the darker states we have Oregon, Washington, Minnesota, Missouri. There are a little darker blue, so they're like definitely in the higher range. Those are like the more high populated areas. And I can also see that over here it's a bit darker, so it's closer. Um, that those ones over there are a little more, but it's kind of spread out evenly because there's some in the this area, there's some in the middle, and there's some over here, and like there's Florida as well, which isn't doing too well. So this is a change in hospitalization over the 2 weeks. So we had Wyoming is a really dark orange, and we had Louisiana. So yeah, so it's just like it gets like it rose very suddenly out of nowhere. It spiked. Um, so yeah. Um, so we have what seems to be like the most dense. Um, Like there's District of Columbia, Delaware, um, Puerto Rico, West Virginia, Connecticut, Delaware are very high for COVID hospitalizations. So that's crazy. It says since April 2020, there's been at least 16,800 people hospitalized for COVID in the U.S. over a 7-day period, and as many as 159,000, a new peak set during the Omicron surge. The country across the pandemic has averaged about 60,000 hospitalizations for COVID a day. So the average David COVID hospitalizations is around this number, around 20, almost 30,000, 27,236. It says around 3,000 average COVID IC hospitalizations, or around 2,941, and it's around 1.5 thousand college average college child hospitalizations, or 1,331. Um, it says COVID hospitalizations have been falling since February. So, but it looks like it spikes up and then it goes down again and then it spikes up again. Yeah, I did hear that like when COVID hit, like they were running out of hospital beds in some states, and like some of them like were even like outside. They had to set up whole things outside because like it got too full. Um, it also says that there's not enough nurses. Um, Hospitals fight the weight of the high patient loads while the number of nurses nationwide dwindles. This shows where hospitals are overburdened. So, just kind of in the Midwest area, near Florida, Georgia, and then we have like a really bad one in Vermont. But yeah, it's pretty good. And there's just more. So let's see. Let's get into, so I pulled up this neat little article, and this one says like it was an interesting article because it says the vaccines offer little protection against long COVID, which is probably, I mean, I don't want to say it's straight out wrong, but I know that you're supposed to have gotten at least definitely one shot already, and you're supposed to keep on redoing it every once in a while, so to make sure you're safe against COVID. So it says the vaccines provide robust protection against hospitalization and death, but when it comes to long COVID, the protection is very modest. So yeah, that's what I was expecting. Um, it says compared to an unvaccinated individual, the risk of long COVID in a fully vaccinated was cut by only 15%. The vaccines are nice what they're designed to do, but modest protection. It says the COVID vaccines were developed early in the pandemic before they knew the existence. They weren't designed to protect against it. Um, um, then they say that study and national healthcare data from the U.S. Department of Veteran Affairs, including medical records, more than 34,000 vaccinated people had breakthrough COVID infections, and more than 100,000 were unvaccinated when infected with COVID from January 2021 through October 2021. People were considered fully vaccinated if they had received two doses of either the Pfizer, BioNTech, or Moderna vaccine, or a single dose of the Johnson & Johnson vaccine. It says only about 10% of cases will result in the condition, but with so many infected, it can still translate to a large number of people. Yeah, so booster, people should get their booster shot. It says boosters offer the most protection against severe acute COVID and reduce this risk of complications. Um, but for long COVID, they're not necessarily the solution. I do not. This is by someone, ally. Says, I don't believe vaccine is the key to limiting long COVID. We need to think about additional layers to protect us from the long term consequences of this virus. But yeah, so that was a pretty interesting article. Um, yeah, it said it isn't pragmatic to tell people to wear a mask for the next 10 years. That is crazy to wear a mask for 10 years. I don't know. Yeah, that'd be a little too much. Um, yeah, so let's see if there's any better articles um, about COVID. Um, so it looks like the cases have went down, but the deaths have went up. There is an average daily of about 100,000 COVID cases, and so far there's 84 million COVID cases. There's an average 300 deaths, but the total confirmed death is over a million, almost a million and 10,000. So that's crazy. Um, let's see. Just looking for see if there's like another good article to read. Um, mhm. Do, 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 do. Mhm. Yeah, I didn't remember that it said like COVID affects like older Americans more than like younger people. So like they're like more risk. So they have. I remember. I think when they were rolling out the boosters, that they prioritize old people having it first because old people can have it first and they can also spread it. So I remember how that was going. Since FDA makes almost 6 million more people eligible for the Pfizer's COVID booster dose. There's Omicron. But yeah, so I think that was a good video. So I just went over a little bit about COVID. So yeah, if you guys enjoyed the video, thanks for listening. Um, and I hope you guys have a good time rewatching this video if you want to. All right, have a good day. Peace.